Good afternoon to all of you on the East Coast, and good morning to you if you are on the West Coast. My name is Dr. Jose Leon. I am the Clinical Quality Manager at the National Center for Health and the Aging, a project of North American Management. I want to welcome and thank you for attending today's webinar, Successful Models for Reaching Older Latinos. This webinar is being recorded, and the resources, slides, and other materials will be emailed to you after the webinar has finished. At the end of the webinar, there will be a question and answer session, and we would like to ask you to complete the post survey. This post survey helps the National Center for Health and the Aging to improve our webinars. The National Center for Health and the Aging provides training and technical assistance to strengthen the capacity of federally funded health centers to increase access to healthcare, eliminate health disparities, and enhance healthcare delivery for the 39 billion or 13% of the residents of the United States who are 16 years of age and older. This is the website. Our website is www.healthandtheaging.org, and you will find information on clinical care, resources like fact sheets and other printed materials, and information about the technical assistance that we provide. In 2008, Hispanic persons made up to 6.8% of the older population. By 2050, the percentage of the older population that is Hispanic is projected to account for 19.8% of the older population. In 2008, 92% of the Hispanic persons aged 65 or more needed help from other persons for personal care, as compared to 5.7% for non-Hispanic whites and 10.3% of non-Hispanic blacks. In 2007, about 7.5% of Hispanic older persons reported that they had no usual source of medical care. I am very pleased to introduce Susan. Susan Vega has been assisting older adults and their families at Alivio Medical Center since 2004. As the Senior Programs Manager, she coordinates the activities of volunteers and staff through the Community Senior Advocate Program, Senior Health Insurance Program, Senior Medical Patrol, as well as the management of the Pilsen Satellite Senior Center at Casa Maravilla. There, the team provides expert information and assistance to seniors and the people who care for them on a variety of topics, including Medicare A, B, C, and D, Medicaid, Medicare saving programs, low-income subsidy, benefit checkup, and other local, state, and federal programs. The Pilsen Satellite Senior Center also features congregate meals, fitness, wellness, live enrichment, and cultural programming. A key focus of the work of Susan has been developing partnerships and engaging the hard-to-reach Latino community. Alivio Medical Center has formal working relationships with the Chicago Department of Family and Support Services, Senior Services Area Agency on Aging, the State of Illinois Department of Insurance and Age Options, and Ms. Vega holds a Bachelor of Arts degree from St. Xavier in Chicago. I am now turning this over to Sue. Good afternoon, Sue.
Okay, good morning or afternoon, everyone. Thank you for the nice introduction, Jose. So we are Alivio Medical Center in Chicago, Illinois, and we serve the near southwest communities that are just southwest of the city loop, or the city center, what we call the loop. So today we wanted to talk about so the learning objectives for today are, they're there to be right, but to understand how commitment and strategic planning can enable community health centers to recognize and create opportunities to serve Latino older adults, And you're going to hear about some of our successes in identifying and forging partnerships with schools, community organizations, and other entities to build the human resources necessary to serve our older adults, and how Alivio has developed specific approaches to reach older adults with information and assistance for health insurance, public benefits, and the Affordable Care Act, and how these efforts have positively impacted families and communities, and explore how Alivio's holistic approach to community health helps to turn challenges into goals when working with older Latinos. So by way of background, we often hear the questions, and one of them, is there really a specific skill set that is needed to serve older Latinos? And the other question we get, why are language and culture so important? And how do some of these key issues manifest themselves depending on where people are? And so one of the things that I want to talk about is, the issue of language and culture, and how people who are serving this community really need to be steeped in it to understand what some of the nonverbal cues are with people, to help understand what those cues mean. For example, sometimes in certain situations in Chicago and the community that we serve, which is low income, many times it's also a community with low literacy. Oftentimes people who do not speak any English at all, or people whose English is poor, and sometimes even people who speak English and understand it well but prefer to have their health care delivery or information about benefits and assistance with benefits and other kinds of services in Spanish. They are just much more comfortable with that. And the other thing that comes up quite a bit is low health literacy, because in many of the countries of origin of our folks, especially in Mexico, especially in rural Mexico, but not only in rural Mexico, the healthcare delivery system there is quite different than it is in the United States. And it is not unusual for people not to have seen a doctor in the past 10 years, in the past 20 years, because culturally you don't go to the doctor unless you're sick. And for women, when you're pregnant, that doesn't mean that you're sick. So these are things that we know when we work with the community, that if we are part of that community, we look like the community, and we share language and culture, we will know. And those who do not share language and culture will learn as they go along. But it's important because depending on who the person is sitting in front of you, you will know whether to ask if they can read something or if they understand. And that has to be done very delicately. Otherwise, you'll never see that person again and never be able to help them. So Jose talked a little bit about the statistics and the demographics. And I don't know who's on the phone, but you will recognize yourself in this if you are serving significant numbers of Latinos. The places where you find most older adults are in the urban and suburban centers in California, Texas, New York, Florida, and Illinois. And one of the other things that is happening, especially in Illinois, is that people are skipping Chicago and going straight to the suburbs. So that's something that's just out there for people to know and understand. And in the Alivio service area, we are in Chicago on the near southwest side. And if you think of a pie wedge, starting with the city center and expanding further and further as you go west, we are the second largest contiguous population of Latinos in the United States. So what are some of the realities in our community? I think these are some of the realities that lots of communities face. Dwindling resources, both public and private. We hear from our funders that where there used to be more money in the coffers, there were real significant setbacks during the financial crisis several years ago. And those are things that are just realities for us, and I'm sure for other organizations like ours. And as we know, public funding in this area has become increasingly more difficult. We, for example, 2 years ago, in the part of the budget that goes for programming for the senior center, took a 60% cut. And you can't have cuts like that without it significantly affecting your operation. So some of the other things that often happen are what we call lack or loss of focus. When, as in the city of Chicago and in other places, the organizations or the parts of the government that are responsible for administration of the or allocation of the administration on aging funds that flow through states and then cities and other local entities often are merging, as they did in Chicago, and where we used to have champions and many more champions for older adults, we find that to be less true. And with shifts in the leadership of various entities in the city, county, and state, that obviously has some impact. So, so it's sort of an uphill battle for getting action. And one of the other things that happens in our community, and I think in lots of communities, but in the Latino community in Chicago, is that there are lots of people who, for many complicated reasons, do not understand and have not fully engaged in the civic life of the community. They are often active in their churches and very little else. So we also see it as our responsibility and our work to help people understand what their responsibilities are and how to fully engage. All right. So how are changes impacting older adults in our communities? One of the things that's happened in, of course, it's on everybody's mind right now is the Affordable Care Act. And we have an interesting story in Illinois. Cook County in Illinois is the most densely populated county in Illinois, and that's where the city of Chicago is. And when the Affordable Care Act was passed and the leadership of the county took a look at all of the possibilities, the leadership of the county asked the federal government for a waiver on Medicaid expansion. And so that allowed allowed Cook County to implement the Medicaid expansion for adults, for the new population of adults, a year early. So starting in January of this year, January 2013, there was a broad-based effort to enroll adults between the ages of 19 and 64 into the new Medicaid program in Cook County called County Care. And the original goal was to enroll 130,000 new Medicaid cases, new Medicaid people, the adult Medicaid expansion. And as of the end of September, we had enrolled 135,000 people. So we were pretty sure that we got just about everybody who was eligible. And when I say we, it is entities like Alivio Medical Center, who we're a community health center, federally qualified health center, and so we help to enroll many, many of our patients and community members, and all of the other FQHCs in the area, as well as community organizations, churches, other governmental agencies like the Chicago Department of Public Health, and just all the partners who were able to do this. So this has been a wonderful thing, and we expect that the coming implementation of the rest of the Affordable Care Act will be of great benefit to our communities. And I'm looking at this, and since I wrote this PowerPoint presentation, as we all know, the employer mandates have kind of been put off. The individual mandates are, like all the new parts of the Affordable Care Act, sometimes difficult to explain to our folks, and there's lots of confusion and hesitancy, I would say, on the part of our community to enroll in these things because they don't really understand. And in doing the outreach on the Affordable Care Act, we know that one time is not going to be enough. When we have done workshops in schools, for example, where we made contact with an individual who had questions and they asked them after the presentation, and then there was a meeting with those folks right after the presentation, and then they make an appointment to see us after they ask us a bunch of questions on the phone, and then they come in to see us and they ask more questions. We talk about the process. We try to do the application, and the website crashes or it doesn't work. So we know that we're going to see those folks again. And once we successfully enroll them, they will be back to find out how they pick a provider, and they will be back to ask us how to use the product. And so what we see this whole process is building the relationship and the healthcare literacy of our constituents and the members. So one of the other things that we're hearing about almost every day now is immigration reform and what this means to our communities. I was at a conference call yesterday with some folks from CMS and the National Council of La Raza. And when we're looking at the kinds of issues that our community faces, I'm looking at a summary that was done by the National Immigration Law Center. And these are just the highlights of frequently asked questions on the Affordable Care Act and mixed status families. And it is 7 pages long. So the complexity of this is quite a challenge, and the availability of good materials in Spanish is still something that's an even bigger challenge. And of course, this complicates everything that we're trying to do for our folks. So Alivio Medical Center, our senior programs, the tagline for Alivio Medical Center is an active presence in the community. Our founder and current executive director is Carmen Velasquez. She is quite a formidable leader in our community and has been for many years. and she is going to retire at the end of January. And she has been the executive director for 25 years. Alivio will turn 25 in January. And so we don't know what that's going to mean for the future of senior programs. We think that our board and the leadership of the medical center will continue to think that seniors are important and that we need to find a way to continue to serve them. But when there's new leadership, everything changes. So Carmen has always seen Alivio as a force with some specific missions. The delivery of health care is obviously critical to the mission, and it is the core of the mission. But it's always service and advocacy, both the things. And of course we have 501c3 status, so there are some limits to the kind of advocacy that we can be involved in. That said, Carmen and the organization have always been very active in efforts for a just immigration reform policy, health care for all, and workforce development. And within that, we've fallen doing our service to older adults and their families. And I'm not sure what this means. So I think lots of us who work for Alivio have had some experiences in other organizations that served more diverse communities, and have found that we really like this niche of working in the Latino community where we're serving people with very specific needs. There are lots of opportunities in that. There are lots of opportunities to partner with community organizations who would like to be doing some of this work but don't know how and don't have the capacity to deliver the things that we can. So we quite often work together. And as we are working together, we see that we can develop a specific set of strengths, a specific set of skills that meet the needs of the community where they are today. And you know, we talked a little bit about the barriers, and they have to do, again, mostly with resources. And we'll see what happens in the future with the change in leadership, both at the micro and the macro level. Okay, so the Pilsen Satellite Senior Center, we are a satellite of the Chicago Department of Family and Support Services Area Agency on Aging. And this is one of those true public-private partnerships. Our partners are the City of Chicago Department of Family and Support Services and the Resurrection Project. The Resurrection Project built the building where the senior center is housed. We're on part of the first floor of a 72-unit building that is independent apartments for people 55 and over. And the Resurrection Project built out 7,000 square feet of the first floor to be the senior center to the specifications of the city. The city put in the systems, the equipment, the furniture, and the pictures on the wall. Although they paid for it, I picked the pictures. And this is, you know, what we're trying to do is to provide a very safe, comforting, welcoming atmosphere for seniors to come and do the things that they like to do in terms of keeping active, both physically and mentally. And it's a place where almost all of us speak Spanish, so that people hear their language in a way that, and we communicate with them in a way that makes them comfortable. So some of the challenges, again, as we look at the range of services and programs that are available, language continues to be an issue. We see brochures, pamphlets, newsletters, all kinds of things that are written in Spanish for this population, for seniors, and we find that people who we know are well-meaning are still sometimes more preoccupied with impressing their bosses about how well they can write rather than thinking about the end user. So we know that the messages need to be simple and short and written at a very basic level, especially for flyers and invitations and those kinds of things. Communication with our constituents and the organizations and entities that are responsible for funding these programs is an ongoing challenge. Many, many times we are too busy taking care of and serving the people who are in front of us, who are on a deadline, and we need to spend an hour and a half, sometimes 2 hours with them if they're new to Medicare, for example, to provide all the information that they need so that they can make an educated choice. And when we're doing that, sometimes the other things like writing reports, participating in panels, reaching out to the state director for the Department on Aging tends to be less of a priority. And so those are the kinds of things that we are up against, and resources, of course, are always an issue. And so some of the guiding principles that we've used is one of the things that that I tell my staff and volunteers, or our staff and volunteers, is that if something isn't working, if people don't show up to something, then we're not doing something right. If we are providing the right information in the way that people can understand it, and these are the programs or services that they need, then people will come. We don't play bingo. We're a loteria-free zone because, first of all, it's gambling, and there's plenty of other things to do. So one of the things, the other thing is we know that we can't always do everything perfectly. In a perfect world, there are lots of things that we would offer here that we cannot. But that doesn't mean that it should stop us from doing what we can do, and look for that to have a great impact. And we also are sure to check in with our constituents to see how we're doing and ask them what else they'd like to see. So in building the leadership, so we're using organizing principles, the idea that, you know, not all of us are going to be expert in everything, that we need to work collaboratively, that we need to be aware of what the realities are in the community. We recently started doing some off-site SHIP counseling, Medicare counseling, and we need to really understand where we are in those places as well. So we need to be sensitive to those communities and the organizations that are housing us. And so we're working with established organizations and establishment organizations, and that means that entities like the Illinois Department on Aging and the Chicago Department of Family and Support Services. So they're, you know, they've been doing this for a long time. We need to see what we can learn from them. We're always looking for partners. It's interesting where you find them. And we look at the assets in the community. In Pilsen, we are very fortunate to have to be housed in a community where there is a long history of working together and in coalitions, in partnerships, and sometimes the self-interest in working together is very apparent, and sometimes it's not. Sometimes you have to dig a little bit deeper, and those are where the most interesting partnerships happen. So some of the things that we've done that have been successful are working with elected officials, with our most local people, including our aldermen, our county commissioners, and then our state elected officials. They are very helpful in making sure that the right policies are in place to enable federally qualified health centers, community health centers, to grow and continue to serve the communities. When we first moved into the senior center in 2011, I had one other staff person who was working with me on a full-time funded project. And it became very clear that we were never going to have a lot of money to hire a lot of staff. So one of the things that we did was to develop partnerships with colleges and universities where we could get really enthusiastic, smart, good young people and not so young people to be interested in these programs. And sometimes they are with us as interns, sometimes they are with us as federal work study, as part of fellowship programs, and sometimes through other kinds of work study programs. And we have found really great people that way. And it is an investment of time and supervision, but we have found that it has worked really well for us. And so those are the other places where we have found volunteers and people who now have become staff through the direct service and some of these other youth service agencies, community organizations, and our own clients and program participants. So when we're talking about honing the messages, one of the things as we develop informational and educational pieces for our community, we really think that these things must absolutely be done in Spanish, in plain language. They need to be developed in Spanish. We see terrible, tortured translations of things that are almost useless. And we know that the information, to be useful, needs to be brief and have some simple messages that focus on the actions that need to be taken by the person, by the community member. And we really try to give this advice to anybody who will listen to us. Sometimes they hear us and sometimes they don't. But we think it's our responsibility to continue to let people know, look, we serve this community. This is our community. We know our community. Use us as a resource. And all of these things always should have a name, address, and phone number so that people can actually talk to a person when they need help. And the key lessons learned is, again, it's not always necessary to wait for optimal conditions to do something. That we should focus on what we can do. And we find and look for people in the community who share and support our vision. Keep a sharp eye on the mission. Make sure, as I tell my young staff and the folks in the community, okay, what did we do today to make this a reality? And when we're in doubt, always go back to our constituents and ask, are we doing okay? What else should we be doing? Is there something we should not do anymore. They're the checks and balance for us. And with that, I would be happy to take any questions.
Thank you, Sue, for this wonderful presentation. We're going to begin the Q&A session. If you have any questions, please submit it through the question box on your control panel, or use the hand icon and your line will be unmuted. All right, we have a question, Sue. Is there or do you have any data available on the literacy levels of the U.S. migrant Hispanic populations?
I don't have anything at my fingertips, but there are organizations that do. The Latino Policy Forum is one. I know that they have done some really good work on that, and also I think they are still around to the Latino Research Center at Notre Dame. And then there is also a researcher named Rob Perrell who has done some work in this area. And if you like, I can send the information to Jose, and it can be included in something. I don't know where you would put that, but I could look for that.
Sure, we can include them in the resources that we send to the attendees, and that would be great. So thank you very much. There are some other questions popping up. There is another question. How do you educate Hispanic populations about their civic duties and become health advocates for themselves?
We do that in a number of ways. When we do counseling, for example, on Medicare or Medicaid, any other of the public benefits programs, it is our standard operating procedure here at the center where we do counseling through SHIP, is when we see a permanent legal resident card that is where it indicates that people have been here for 5 years or more, we ask, why haven't you become a citizen? What are the barriers? And we hear all different kinds of things, and we encourage people to get more information. And we give them the information about local agencies who can help them with the process. Because lots of times people do not have information about programs that can help pay for it, for example, where there are opportunities to take the tests and to take classes where it's at little or no cost, and fee waivers and those kinds of things. So we actually give them that information in their hand. And we know, because these are partner agencies, because we know the people in our community, that when they call, they will get the right answers. And community health centers, including Alivio, are not only charged with improving the health of the patients, the individuals, but also we're charged with improving the health of our communities. So there is, this is the way we do business with our patients and with our community. We encourage them. We talk to them about self-management. We talk to them about the questions that they should be asking. And one of the, there's a great presentation, and I'm not going to remember where it came from originally, but it may be the National Institute on Aging or Health Aging, I'm not sure. But there's also a great presentation called How to Talk to Your Doctor, Cómo conversar con su médico. And I think I added a slide about how to how to engage your doctor in around difficult issues, and that includes things like billing and questions about why things are done in a certain way in their office, so that people can understand what the theory is behind what their doctors are doing. Now, of course, all of this is, we're all headed to the same place in terms of patient-centered medical homes. And this is going to be quite interesting because these are very, very middle-class concepts. And there's going to be a learning curve. But again, that doesn't mean we shouldn't try.
Great. Thank you, Sue. There is another question. This is an interesting question. In Chicago, are older Latinos trying to find work, and do you assist those who still need to make a living?
There are older Latinos who are looking for work, and lots of them who are working. There are hundreds of people who are working in the Title V program, which is the 55 and older program that is run through the Illinois Department on Aging, and under the auspices of many different community organizations. And some of them do clerical work, and some of them do, a lot of them are involved in home health or home services for people who are even more elderly. And we do not have an employment and training program for older adults at our agency, but we do work closely with Operation ABLE and the City of Chicago Department of Family and Support Services and the AAA in suburban Cook County, which is called Age Options, and with other organizations that work specifically on employment and training issues. The National Latino Education Institute, and also SARE. One of the things that we find is that many of our older adults probably would qualify for disability if they had worked longer. Especially in the past several years, the rates of people who are saying that they would like to work and can't work anymore are people who lost their jobs because the factory that they worked in closed, and they've already developed a number of disabling or difficult health issues that prevent them from finding work in the current market.
Great. Thank you, Sue, for that response. I have another question for you. Do you deliver any specific self-management programs that help the Spanish-speaking community?
Yes, we do. We do Tomando Control de su Salud, which is the Stanford Take Charge of Your Health self-management program. Tomando Control de su Diabetes. We also have a program called Mi Salud es Primero that is part of an initiative with, I'm going to forget who these folks are because I don't work with that directly myself, Peers for Progress, Transformed, and the National Council of La Raza. We've also worked with the University of Illinois. We're one of the flagships for their Informa y Fuerte program, which is an arthritis self-management program. So yes.
Great, thank you. So, and this is like a follow-up of that question. Is there any trouble, do you have any trouble recruiting leaders or retention of leaders for those programs?
Retention is always an issue. People's life situation changes. People move. People get jobs. You know, lots of those things happen all the time. But we have a cadre of volunteers and a pool of people that we can recruit new folks from. We recently, in the past year, for example, and this is not the self-management stuff, but we did have, well, you know, there's two parts of it. This year, we identified, trained, and are working with 12 new SHIP volunteers, Senior Health Insurance Program volunteers, who do Medicare counseling, and they are doing it here at our center and at 4 off-sites at a community center, one of the alderman's offices, a church, and a hospital. But previously, we had funding from the Retirement Research Foundation to do the Tomando Control de su Salud program. And over 3 years, we trained a little bit over 100 class leaders. And I'm a master trainer, and one of my colleagues who now works with me here is a T trainer for that program. So of those 100 people that we trained, I would guess that maybe we're in touch with about half of them, maybe a little bit better than that. But again, not all of them were seniors, and you know, depending on what their tie was to the organization that was sponsoring the class or the series, yeah, that's kind of the crux of it. That, you know, that relationship is the most important one.
Great, thank you, Sue. There is another question that is associated with the one that you just responded. Can you speak a little about the promotion and the success of the Tomando programs? Do you have any information for us?
We had great success with the program. You know, I'm going to forget the numbers again, but we had at least a couple of thousand people who went through Tomando Control de su Salud at a couple of dozen different community organizations, churches, different places, and it's a great program. You know, we love the program. We just kind of our funding cycle had run its course, and then we got began this other effort through Mi Salud es Primero, and because that was diabetes specific, the health center just decided that that was the way we needed to go at this point in time.
Thanks, Sue. This is a question from a health center in a small town with a large and growing Hispanic community. They have a no-show rate of 40%, and they haven't been able to reduce it even by introducing a policy that 3 missed appointments in a year will cause them to be released from the practice. And they're asking how can they effectively communicate the importance of keeping appointments or canceling them in advance?
Well, this is medical appointments, and that's a little bit out of my area of expertise, but I do know that some of the things that the medical center has done is with the implementation, and you know, and it was slow in the beginning because things just kind of ground, you know, they slow down when you implement electronic medical records, which is what we're in the process of doing. But there were more opportunities to call people with reminder calls, and we have issues again with bad phone numbers and an inability to get a hold of people. That's, you know, that's a reality. And then I think one of the other things that the dramatic improvement process that we went through, that's a whole process that another part of the organization was involved in, did radically improve the no-show rate. And I think that part of that was also the ability to make same-day appointments. And that was something fairly new for us in the past year or so. In our community here, it's like in lots of places, the concept of, not going to the doctor unless you're sick is, something that is going to be still a learning curve for us.
Okay, thanks. So to the attendee who sent that question, if they need additional assistance, please contact the National Center for Health and the Aging, and we will be glad to help you with all your concerns. At the end of the webinar, you will see some contact information. So do you use a mobile unit to increase access to care for older adults?
I don't know. That sounds like a clinical question, and that part of improving systems and all those things, I'm not directly involved in.
All right, thank you. There is another question. Does Alivio offer legal services, and has that proven to be a good outreach strategy?
We do not offer legal services, but we work with partner organizations that do, including the Legal Assistance Foundation of Chicago. And then in Chicago, we have the good fortune to have other groups that are working on important issues on health and disability. So we work with the health and disability advocates, and also with the Chicago Legal Clinic, which is an organization that was founded in one of the Latino communities in the city. So, people need legal advice all the time. That that's not our forte, and so we do refer those out.
Okay, thank you. So there is one more question. Do you have a, let me see, okay, for older adult patients, Latino patients, what are the best methods to inform them of issues such as insurance or self-checks outside of the medical visits? Like, are pamphlets most effective with older Hispanics, or what is the best outreach method?
The best outreach is in-person, face-to-face, and we do that in lots of ways. We are out in the community all the time. We are added to my title is now ACA Outreach and Enrollment Programs Manager, as well as Seniors Program Manager. So we are out almost every day of the week providing information about services and programs that are available in the community, including public benefits like Medicare, Medicaid, the Medicare Savings Program, the Affordable Care Act, which is called Get Covered Illinois. And so we continue to also, a lot of it is based on trust. And so if the initial contact is something where people feel comfortable with you, you speak the same language, you are concerned about their concerns, then that comes with time and with good care.
Thank you. So there's one more question here popping up. Do you use I'm sorry, which community organizations have assisted with developing programs or providing services to your special older adult population?
Which organizations?
Yeah, the community or...
Well, we have worked with the Resurrection Project, which is kind of an umbrella organization. They do mostly what are they? Community development. They're the local nonprofit community development organization in our area, and then lots of our partner agencies like Mujeres Latinas en Acción. So we're making sure that we are reaching out to specific needs of older women. There's a Pilsen Neighbors Community Council. There are probably dozens of them. And I'm happy to send along information about who those are.
All right. Thank you, Sue. And I do not have any other questions in the queue. To the attendees, to all of our attendees, please complete the post survey. This helps the National Center for Health and the Aging to improve our webinars. And I want to thank Sue one more time for this wonderful presentation. We need people like Sue to keep us abreast of topics like the one that she just presented.
Thank you.
See, if you have any training or technical assistance needs, please contact any of our talented staff members. And once again, thank you very much for attending this webinar, and thank you, Sue, one more time for this great presentation.